Medicaid has become a staple and a necessity in a lot of lives within the United States. Those that rely on Medicaid for healthcare costs, such as doctor's visits and hospital stays, are those that are considered low income. This status of low income depends on a variety of factors, including income, household size, disability, and family size. Medicaid is funded mostly by the federal government and takes place at state level, meaning that its functionality varies from state to state based on each state's guidelines, qualifications, and restrictions. The term Medicaid expansion refers to the actions that took place upon the passage of the Affordable Care Act and its goals of expanding healthcare coverage to cover all of those with an income level below a certain level. With Medicaid expansion, other factors, like household size and disability, are not necessarily considered. If a state has chosen to expand Medicaid coverage, people can qualify based on their income alone, should their income be below 138% of the federal poverty line. This new option to expand Medicaid is an optional choice, determined by the state, therefore not all states have chosen to expand, leading to some discrepancies between states in relation to covered costs. Medicaid expansion is meant to help patients that would not otherwise be able to afford necessary health services. However, in the states that do not undergo Medicaid expansion, hospitals providing these healthcare services could potentially experience financial issues. Should a state not expand the Medicaid healthcare coverage, this would increase the number of uninsured. These uninsured people will still need medical care and healthcare services. The only difference is that they will not be able to pay the hospitals for those services, leaving the uncompensated costs to programs such as the Medicare and Medicaid Disproportionate Share Hospital. The uninsured could outgrow the allotted thresholds, causing a deficit of funds. Uncompensated care costs account for services that are not paid for by either the patient or insurer. This usually comes from the uninsured population. Uncompensated care is delivered by all types of U.S. hospitals and creates bad debt as well as increases charity care. As of 2015, according to the AHA, $35.7 billion was attributed to uncompensated care costs, which is 4.2% of total hospital expenses. States who have chosen not to expand Medicaid include Alabama, Florida, Georgia, Kansas, Mississippi, Missouri, Nebraska, North Carolina, Oklahoma, South Carolina, South Dakota, Tennessee, Texas, Wisconsin, and Wyoming. Idaho and Utah are still considering expansion as of June 2018. At this time, there are 34 states, including DC, that have chosen to expand Medicaid. Here's a map showing these states. Around the country, more than 3 million Americans fall into a health insurance coverage gap. This means that they make too little money to qualify for tax credits to purchase health insurance on the marketplace, but too much to qualify for Medicaid coverage. They are stuck in the gap with no affordable insurance options because the state where they reside have opted not to expand Medicaid. The impact of states that have expanded Medicaid has been striking by large gains in insurance coverage, a healthier workforce because more people are using cost-effective primary care, and a drop in the amount of uncompensated care hospitals are providing. Those who live in expansion states are protected if they switch or lose their job, or if they have a serious health condition that only insurance is able to pay for. On the contrary, states who have chosen to not expand Medicaid put their residents at risk since they remain one illness away from losing their life savings and going into debt. Closing the coverage gap benefits workers, businesses, and the state's economy.